we're zooming in a little bit right now on our patient Mountain Meadow. How you doing, Mountain Meadow?
I'm good.
You,
I'm here.
You're rocking and rolling today?
Yeah.
It's Friday, and you'd like to have a mole removed.
Yes.
How long you had that mole?
My whole life.
So you were really born with it? For reals?
I think so.
Okay, as far as you know, right?
Yeah.
Has it ever bled?
No.
Has it been changing colors or doing unusual things like turning flips?
Not that I noticed.
Does it ever talk to you?
Yes.
Does it ever say things to you?
Yeah.
Is it ever rude to you? It's been rude to you in the past, hasn't it?
Yeah, it just stays there.
So, you're okay if we video your procedure for our friends on YouTube?
Yes.
Okay. Gumby Jean, if you'll dab and pad and all that, it'll make it easier. What did I say? Mountain Meadow, huh?
Mountain Meadow.
Mountain Meadow it is.
What you need?
That's it. You got it. You ready, Mountain Meadow? We're going to go ahead and spray a little cold spray.
Yeah,
then you're going to feel a little stick sting and a burn. Here comes right now. Are you ready?
Yes.
So cold spray, and then there it is.
Finger burn. I think I just froze the needle.
No, you just got my finger pretty good though. That's okay. No hurry. Is it burning?
Yeah.
Should burn a little bit. If it doesn't burn, it means it's not working. So you kind of want a little burn. Okay.
Sorry.
Good. And we have a 15, or do we have an 11, or do we have both?
I just grabbed both.
You got
just in
both,
case.
didn't you? Okay. You okay? You're not gonna pass out on us? Okay. We have a visitor in the
Audience.
in the Tomball, in the official Tomball Turtles operating suite. Yes, we've been sponsored by the professional sports conglomerate, the Tomball Turtles. You're going to feel, oh, did I touch the camera with my shoulder? You're going to feel just a little bit of a pressure and a little cut. We make this incision. We want to get close, but we want to be sure that we get it all. And this is a 15 blade. And this is a nice scalpel to use for this kind of procedure because we can angle it. Are you feeling any pain?
No.
Okay.
Are you nervous?
Yeah.
She's nervous because she didn't have any time to really...
Think about
Take
it.
it all
Process
in.
it.
Yeah.
Yeah, it's like, what? He's going to do it when?
No.
Right now.
Actually, Gumby Jean was already in her exit jacket.
go.
She was about to hit the door. So, there we go.
Didn't bleed a lot either.
It's not
so
gonna,
that's
it
good.
shouldn't. We used a little lidocaine with epinephrine buffered, right?
Mm-hmm.
We call that the Gumby Jean House Blend Special.
Looks like an eye.
It does look like a little bit of an eye, doesn't it? Yeah. We're gonna just come like this. I'm gonna come right over here, and I'm gonna grab onto that. I'm just gonna make a little incision. Gumby Jean, you get ready to dab for me, okay? And there are lots and lots of ways to do this. And in the primary care setting, the thing I think that's most important to remember is just, if you're the provider, do something that you're comfortable with. You don't have to do anything more than just make sure that you get your, get your line straight. Make sure you get the entire neoplasm, get the whole thing, so that we don't have to come back later and do it again, right?
Yes.
That would be no fun, right?
No.
Okay. So I don't think you and I have been this close before, have we? You feeling anything?
No.
Because if you do, we can always add more medicine. Gumby Jean's a specialist at that, getting us more medicine. So this, we would call this a mole, right? For terminology in the chart, we would call it a neoplasm, which just means it's just an unusual growth. We suspect, of course, that this is benign. We don't suspect that this is cancer, especially for something that's been here this long, right?
Yeah.
So no hurry. It's almost gone. It's gonna be kind of sad, huh?
No.
No?
No.
And what's that? You wanted to save it and have it done like
Frame it.
baby bronzed, like they do
Yeah.
with baby
She's gonna
shoes?
dip it in gold and hang it on her neck.
Yeah.
Just a
Baby
little
C.
bit more. So, you want to see what it looks like?
Oh my god.
So that's what it looked like. And I feel confident that we got the whole thing. So that looks really good. We'll put some
Yeah.
stitches in here. Let's be sure we send this off to pathology. Come,
Okay.
Jean, please, ma'am.
Yes, sir.
And would you push my glasses back up on my face? Thank you. Whoa!
See a lot better.
Mountain Meadow, how do you do? I can see you. And we're going to put a little stitch in right here. So it's Friday. Who's got the best Friday plans?
Me.
What are you doing?
I'm going home and I'm doing
Oh, no, I was gonna say
nada.
the
You're not
single
doing
girls.
anything.
You're married.
We're married.
Yeah, you're married now.
Tomorrow I may do a little bacon tear. If she comes over.
Oh, a little bacon. Okay. What would you do? Like,
Retwist it.
do a little twist and turn? Twist and tie? So anytime you make an incision into the skin, you're going to have a small scar. The idea is to reduce the size of the scar as much as possible, or even better sometimes is to disguise the scar as a wrinkle. Right?
Yeah.
And that's the technique we're employing right now. So we're actually making the incision right in with where you have a natural kind of wrinkle line in the neck, right? So it'll be less likely to be noticeable. Yeah, really, you got me the 5-0, didn't you? You got me the good stuff. All right, how about a little snippety snip?
Oh, I'm about to dab
You
it.
can dab too. There you go. So we're only going to want these stitches to stay in about 5 or 6 days.
Okay.
I'll keep you on schedule.
Mountain Meadow. Try to go right there. That is just exactly where I want it to go. I keep.
That was being stubborn.
Well, what I'm doing is I'm grabbing the other stitch accidentally because it's laying right across there. Could I get a forcet real quick? You'll see what I'm talking about here in a moment. Can you see okay? Yeah. If you look right here, there's actually a
Oh,
stitch.
yeah.
So
I
I
cut it,
I
yeah.
kept grabbing the stitch right there. If you hold that, we might need it actually again.
Yeah, it's in the way.
Kind of wants to get in the way there. But not bad. So how do you feel about having your procedure on YouTube?
Never thought it happened this fast.
So what we'll do is we'll make sure your identity is protected.
Okay.
We've really focused in super. We've got you on super focus here. What's the percentage of magnification it's reading there, Gummy Jean?
2.8.
2.8. Well, that's a pretty good magnification. We're ready for a cut there. And I think you're gonna need just one more stitch. Got a little bacon in the room.
Hi, guys. That's my sissy.
And then one right there.
Although she was adopted.
Was it her that was
my
adopted?
bad. Sorry, bacon.
We still love her. Even if she was adopted, it wouldn't
Yeah, I
matter.
love her just like she didn't get dropped off on the doorstep. In one of those little baskets.
I have to admit, that broke my concentration. Usually, the interesting banter usually doesn't affect me, but that one did. I guess because I'm just such a big little bacon fan.
Yeah.
Yeah. You would expect that, right?
Right. Alexa isn't accepting her reality.
Uh-oh.
Oh, so it's actually me.
All right, let's go ahead and do that one. And then we'll decide, do we want to get another
Uh-oh.
stitch on
I'm
there?
gonna trim them.
You want to just trim those a little
Yeah,
bit?
stay a little.
We actually, I think we're just fine. Nice and it's come together very well. And if you'll let me have that forceps back. There we go. We'll make sure the stitches, knots are all on the same side of the wound there. There we go. So just a little dressing, Gummy Jean.
All right.
Now, don't put any ointments on that, okay?
Okay.
All
Keep
right.
it dry.
Dry, she can't wet it.
Don't get it wet. You want to keep it dry
Okay.
and covered. And do your best to think about a mountain meadow.
I just
Sounds
took it out.
relaxing.
It does, doesn't it?
So is it
Me
better
relax,
to take
huh?
a bath instead of a shower?
Well,
Well,
you can do that.
you can take a shower.
Scrub it.
And a lot of people are in these kind of situations where they'll get stitches. And the important thing is just don't allow water to get right on it. So if you want to put a dressing and over it, like a special
Like a
covering or
waterproof?
something, so yeah, to kind of waterproof it a little bit for a few days, that'd be a good idea. After that, it's okay if it gets wet. Just don't put any ointments on it. And the reason I don't want you to put an ointment on it is that if you put ointment on it, it'll actually push the ointment down into the wound and it'll open it up so it doesn't heal correctly.
Okay.
And it's infected.
Yeah, and well, not necessarily infected, but what it can do is it'll make the scar larger.
Oh, okay.
And the other thing is sometimes people develop a reaction directly to the heavy petroleum base in the like Neosporin and other like petroleum-based antibiotic ointments. So it's best to just keep it clean and dry. Okay.
Okay.
You did fantastic. Thanks for sharing your procedure with us and all our friends on YouTube.
Thank you for getting it over with so fast.
Well, you're welcome.
Bye, guys. Have a great weekend. Bye.
Stay tuned for the Meta 7 video.
Let's go.
It has helped me so very much with working. It gives me a lot more energy throughout the day, and instead of being in the middle of the day, I can get through my whole day, and it's been working really well.
Takes away that afternoon brain fog.
Yes,
doesn't
it does.
Great.
It's been great.
Great. Fantastic. Thanks.
You're welcome.
All right, folks, this is Emily, and Emily's been using Cocoa Skin Plus. Emily, you want to give your personal testimonial?
I started taking Cocoa Skin Plus about 6 months ago, and since then I've noticed a huge difference in my skin. It's softer, my hair is softer, and it's grown so long.
Awesome.
I highly recommend it. I've definitely noticed a difference. It's definitely helped my hair feel better, my skin feel better, and you can pick it up on Amazon.
All right, check out Cocoa Skin Plus on m7amazon.com. Available, and it was designed by Dr. John Gilmore. Thanks.